You have probably heard the most common IVF myths like IVF guarantees a baby or it's only for older couples. But what about the myths that even smart, well-read patients believe? The ones that sound logical but aren't. Today we are going to burst the lesser known misconception that often cause confusion, false hope or unnecessary worry and explain what science actually says. Coming to myth number 1, more embryos means higher the success. This one seems logical. More embryos, more chances, right? Not exactly. What matters isn't the number of embryos you create, but how many are competent, chromosomally normal and capable of implantation. A lab might grow 10 embryos, but only 1 or 2 may have true potential. On the board, you can see how quality, not quantity, determines outcomes. That's why personalized stimulation and precise embryo selection matter more than chasing the numbers. Coming to myth number 2, if an embryo is genetically tested, that is if it's a PGT normal embryo, it means pregnancy is guaranteed. Even the most perfect embryo on paper still needs a receptive uterus, healthy blood flow and ideal hormonal timing to implant. A PGT normal embryo has potential for success, not a promise. Think of it like a top tier seed, it still needs the right soil and season to grow. This is why implantation remains the most unpredictable step in IVF. Coming to myth number 3, IVF can fix all fertility problems. IVF is powerful, but it's not a cure for all. For example, patients with severe uterine scarring, poor ovarian reserve or untreated metabolic conditions can still limit its outcomes. IVF bypasses some barriers, it does not erase underlying biological challenges. That's why comprehensive evaluation before treatment is so critical. Coming to myth number 4, frozen embryos are weaker than fresh ones. This used to be true decades ago, but with modern vitrification procedures, frozen embryos perform as well as a fresh embryo, sometimes even better. Freezing allows the body to recover and the uterine environment gets back to normalcy before the transfer. Data consistently shows equal or higher success rates for frozen transfers today. Myth number 5, if one IVF cycle fails, it means something is wrong with me. This is one of the hardest myths emotionally. A failed cycle doesn't mean your body is broken or treatment failed. IVF is statistical. Success accumulates over cycles. Often we learn vital information from one failed attempt that guides us the next one more precisely. It's science refining itself, not a failure. To conclude, the truth about IVF lies between science and biology, not assumptions. More embryo does not mean more chances. Tested embryo aren't guarantees, and one failed IVF cycle does not define your journey. The more we understand the science, the less room there is for fear and the more control patients can take in their fertility decisions.